Giant support rally at the legislature. The speakers were home care users and their family members.
You can only be ignored for so long before you have to fight back. And we have been called to be on the vanguard of health care, to stand up for Medicare and our Canadian values.
Mr. McRae, please consult and listen to those of us who use the service, not the able-bodied people who think they know what we need.
Does the government have any idea what it is like to begin over and over again the process of entrusting your most intimate needs to a stranger?
The Coalition to Save Home Care had collected over 21,000 names on a petition.
This was a client-driven rally.
Channel 5 News Hour. The home care workers' strike spread to every corner of the province today.
When the strike started, I had phoned my son and I said, I don't know about this strike. I said, it's only 25% of Winnipeg going out. And he said, well, that's just a start, Mom. All of our workers are out on strike. None of them are scabbing. We've had support from the community. And we've really gotten to know each other over this strike. We had lots of response from our town, small town. We had fresh baked cakes coming out and coffee and donuts and tarts, and we thought we might lose a little weight on this strike, but we're not.
It's great to see everybody out. Great to see that you're going to green the town with the lawn sign campaign. We've got several thousand of them up in the city of Winnipeg. I know McRae's riding has got over 400 of them up.
You don't hear about it, but the hospitals are plugged up. The system is plugged up all over the place. Their contingency plan is hobbling along. It is having some effect, but not nearly the effect that they want it to have. So we need to crank the pressure up on these people, and that's exactly what we're doing in Winnipeg and Porridge and Selkirk and all over the province.
Privatization's not allowed! Home care, we are proud!
Minnedosa, we've done Erickson, we've done Rivers, we've done Strathclair, we've done Rossburn, we've done Shoal Lake. We pick a day and that's who we go visit each day. Some of the small towns there is only a few girls working and they feel kind of left out. So it's much nicer when we can get a bunch of girls together and take turns visiting each other's town.
And Buckley has kept us more closer and united. And we're not gonna give up.
Filmon says we privatize. Filmon says we privatize.
Could mean welfare for us, guys.
Could mean welfare for us, guys.
Clients' needs come first to us.
Clients' needs come first to us.
That is why we make this fuss.
That is why we make this fuss.
Sound off.
Well, we started making up our own songs, and it's fun. It gets people motivated. It gets people remembering why we're here.
It's been a little bit of a struggle. I have to bring my 3-year-old on the picket line most days, but she's a little trooper.
Yes, I'm out here to the end. I told Mr. McRae on the phone that I have stamina, I've got spunk, and I'll be out here longer than he will.
I went and visited one client just to talk to him. It was his birthday the same day as mine. Gave him a card and everything. And he was saying, is the strike over? Yeah.
Coming out and seeing everyone every morning.
Having that coffee.
Yeah, that coffee.
We got donuts from the from some of the writers at the Free Press. A lot of ladies from the Philippine community brought all kinds of food out. Hot soup on cold days.
For my clients, I have I've been working for 3 years with home care, and I really find that they have done a lot for me, and they can't be out here doing this because they're sick, so I'll do the walking for my clients.
We're getting to know each other finally, and that's one of the real pluses that they're coming away with. But we really have been isolated in the community in a sense, and very invisible.
If you're BCN, you know it, kiss my ass! We won the bargain!
We're here to bargain with the government. The government has said that the union is not willing to bargain. We're here to prove them wrong. We're ready anytime, any place. And as you can see, the government's too afraid to come out.
The government was also afraid to face the people. So the Home Care Coalition organized its own public hearings.
I'd like to call these public hearings on home care to order.
My name is Ruth Curtis. I am on home care, and
I'm being disrupted by this strike, but I agree with the strike for the simple reason that privatization will not work.
You've got me with a private care company right now. I get a different person every time I turn around. You know, they walk into your home, they say, well, what do you want me to do? And they stand there and they look at you like you're an idiot when you tell them. You're not going to get the quality of care that you're getting with people that are coming to your home on a regular basis.
I received services after the strike from a private home care service. And if this is a test run, it is an incredible nightmare. And then she brought this, a young chap, a very young chap, like I would say, well under 20. Like, he doesn't even know what a quadriplegic is. He has no idea, you know. So I have to have an exercise called range of motion in the morning to get me moving. And if I don't have it, it's going to be a long, painful day. And well, this little kid comes in, he's still wet behind the ears. He doesn't know what, a range is. He thinks it's home on the range, I think.
Dr. Evelyn Shapiro helped establish the home care program in 1974.
Somehow, the public has been really sold a bill of goods about the fact that government can't do anything efficiently, only private industry can do things efficiently. By golly, I mean, if you throw out with the baby with the bathwater, then you have to have your head examined. That's all.
After 4.5 weeks, the government was forced to capitulate. Public support was growing. Client and family pressure continued. And picket lines were holding firm.